Thank you for joining the Brain and Mind Experts, the podcast where we talk about the world's most advanced biomarkers and other diagnostic techniques and innovative treatments for cognitive disorders. Each of these episodes will bring the very latest news and information about how we can potentially help the more than 55 million people worldwide affected by cognitive impairment, and it's forecasted to grow to 150 million people by 2050. I'm Tom Dent, Executive Chairman of Recognition Health. In 2011, Dr. McSweeney and I saw this growing health crisis, and we wanted to be a part of the solution. We believed we could assemble professionals, processes, and strategies to provide a specific diagnosis and then provide the newest treatment and care for people with cognitive impairment in the United Kingdom and the United States. Recognizing the phenomenal progress in research and development over the last decades, affecting the brain and the mind across 10 of our specialty centers in the U.S. and UK, we're providing real hope to those suffering from these conditions. Today, we've got Ray Clark, a celebrated English footballer, or in the U.S. we'd call it soccer, whose career spanned some of Europe's most competitive leagues during the 1970s and early 1980s. He was known for his sharp instincts in front of the goal and brilliant finishings. Ray made a name for himself in his native England and also with standout performances in the Netherlands and Belgium.
So, Ray, thank you so much for coming along this afternoon. It's just such a treat.
It's a pleasure.
To have the opportunity to chat to you. And obviously, we've met before because you've been attending our clinic at Recognition Health.
Yes.
But I just want to go back a little bit. So firstly, setting the scene, there's so many people currently who are very concerned and focused on concussions, subconcussions, traumatic brain injury in contact sports. Obviously, your background is as an ex-professional football player. But I'm just really keen to hear, how did you first notice there was something wrong?
Well, I may have noticed it, but I was putting it in the back pocket, really. It wasn't until my wife kept saying to me, "Look, you're forgetting this, and you're not doing this, and your mood is changing, and etc. etc." And she kept on at me, which I'm glad she did. But we got in touch with various things on the internet, etc., looking for what we could do. And at that time, the PFA were offering to go on get diagnosis.
Yeah.
So we were lucky. She was lucky. She pushed it and got me on to be diagnosed. That came back with the diagnosis that I had amyloids and early Alzheimer's. And then after that, we thought, well, crikey, what do we do? I wasn't too concerned, about it. And after giving it a bit of thought, I just felt that, well, I need to get on a trial if they're out there.
And Ray, before you sort of got to that, when your wife, and thank goodness,
absolutely,
sort of like forced you to really sort of like confront the fact that something wasn't quite right, what did you think might be the problem? Did you think, because there's so much talk about this thing CTE, chronic traumatic encephalopathy, or did you think because Alzheimer's disease is a pandemic, did you think maybe it's that?
I think where it was the fact that with footballers, it was out there.
Yeah.
And when you look at it, you think, crikey, I've been through head clashes, various other things, and it was coming to the fact that was part of the situation for early Alzheimer's.
Yeah.
So, it was a little bit difficult, but I just took the attitude, I am going to have a trial. It will benefit me, firstly my family, like my daughter, my son, my wife, etc., and then it will benefit other players. Mm-hmm. So I would have thought if I talk to other players or they get in touch with me, I can explain what the situation is and what the route is.
Yeah. And did you, I mean, presumably, like many people have never even heard of a clinical trial. They haven't heard of treatments for effective treatments or new treatments for Alzheimer's. How did you find out about this opportunity?
Majority of internet looking and seeing and coming across various different, should we say, drug companies.
Yeah.
And looking at it through there, and then I got a call from a chap, Charlie.
Yeah.
I remember his name, Charlie. This is a bonus. And he said to me, look, we're offering clinical trials. One is Cognition Health. So I said, okay. He said, I'll come back to you. He said, would you be prepared to go on a trial? I said, yeah. So 3 or 4 or 5 days later, he said, right, you've got to be assessed by Cognition Health to see if you're the right type of, should we say, patient, for want of a better word. And which I did. I went down and had various tests, etc. And then fortunately they said, yeah, we'll take you on a trial.
And actually, Ray, to sort of, for people listening, what was happening here was that you'd had some preliminary tests which had demonstrated that you had this high amyloid protein in the brain.
Yeah.
And high amyloid protein in the brain is the hallmark for Alzheimer's disease. And this had been done, in your case, by a lumbar puncture, where we'd looked at, or the doctor who'd been doing this looked at the spinal fluid and could see this biomarker, the presence of this amyloid biomarker in the spinal fluid. And then the reason for seeking out a trial at that point, which was several months ago now, was because there are new medications that are designed to remove and lower and ideally remove that toxic amyloid protein from the brain. And the reason this is so important is because the amyloid protein gets clumped down on top of brain cells and it destroys those brain cells. So this is now a sort of like fight against time to get the medication that will remove the amyloid protein and protect those brain cells from further destruction, or at least very much significantly slow down any progression of your symptoms.
Yeah, I was a little bit concerned about age, being, when I was diagnosed, I was 70 years old.
Yeah.
And I just thought maybe I'm too old to be on a trial, because I can't remember where I've seen it, but they were saying that, anything over a certain age, you're not going to go on a trial. It's not worth it.
So actually, most of the clinical trials are from about 55 to 85 years of age. Some are from 50 to 90. So in fact, you were absolutely in the sweet spot for the clinical trial. And particularly being otherwise fit and healthy, you certainly were, an ideal person to join a trial. And as we've said, this is an opportunity to get what we call a disease-modifying treatment. So this is something designed to actually treat the underlying problem. And how have you found the visits to the clinic? I mean, what's that like? Is it an ordeal, or is it actually quite pleasant?
I look forward to it, actually.
Okay.
Yeah, when we get on, I come down to from where we live. I come down to the clinic, check in, and I look forward to it. All the staff there. I can't praise them enough. They're absolutely great. They're humorous. They're happy. They make you feel welcome. And also lunch is just an outstanding part of the day.
Okay. We try to please. But that's great. And Ray, I think, obviously what we should address here as well is that there clearly is a lot in the press about how people playing contact sports, one, are at risk of getting this condition called CTE, chronic traumatic encephalopathy, which is also a progressive neurodegenerative disease that tends to dementia. And we've seen a lot of information about that from the American football players. But also, and you were asking me about this last week in clinic, that there is an increased risk of developing Alzheimer's disease, Parkinson's disease, Lewy body disease, other neurodegenerative conditions, if you have played a lot of contact sports. And have you been sort of like clear, and particularly when you're talking to other football players, about the difference between how these diseases are actually associated with subconcussions as opposed to the sort of like big one-hit concussions? Is that something that you were aware of before you started finding out more and more about this path?
Yeah, but not significantly. You know, you read articles and you look at that, but it's not, that doesn't jump out at you as such. You know, it's not until you get into the trial and you talk to the people who, you know, are dealing with the trial, and they tell you exactly, like you've said to me and the other staff, how much more information comes back, makes you realise how important it is to get on the trial.
Yeah. And I think one of the things that, and you're in much more contact than I am with lots of ex-football players and actually other contact sports players as well. But I think one of the things which is often sort of like overlooked at the risk of people not realising the risks that they're facing when playing, and also the reason for paying attention to early symptoms, is that it's obviously never a good idea to get a concussion. And, you know, and I think we have lots of guidelines now about concussions. Sit it out. If you're not sure, these guidelines don't go back to play till you're feeling well, at least have sort of like 3 to 4 weeks. Did you sort of like, were you aware of this when you were playing with respect to concussions? And then we'll talk about subconcussions.
No, not at all. I can give you one example. Played this particular game.
Yeah.
Got completely knocked sparko.
I'm assuming that means completely unconscious.
Yeah. And sitting in the dressing room and looking around and saying, what am I doing here?
Yeah.
They thought I was taking the mickey.
Yeah.
But basically they said, get yourself off to the hospital.
Yeah.
So I took myself off to the hospital.
So like, drove your car or
no,
on a bike?
My wife drove the car.
Okay.
And then I can remember vaguely being told, we want you to stay here for 3 hours.
3 hours?
Yes.
Yeah.
Until you feel okay, and basically that's what happened. Then they released, said, right, off you go.
Yeah.
So there was nothing really medically to support any head traumas.
Yes. Yeah.
You know, if you cut your head, well, that might have been a bonus. You had stitches.
Yeah.
But apart from that, there was nothing, you know.
And do you think when you look now at younger players, do you think that they are much more aware of the importance of protecting your head? And
I would like to think so, but I'm not sure. Is it being put out there to them? Is it being explained to them? You know, when they join a football club, whether they are 10 years old or 11 years old, which boys do, you know, I understand that they're saying, well, we'll ban heading, which is, I think, is only delaying the situation, that they are made aware. Then they can make a decision. Well, I'm not too happy with that. I don't think I'll give up football, or I'll do something else. I think they need to be more out there and in your face, really, to say, look, this is the situation.
Yeah, and also the parents of the younger children being really fully aware.
Yeah.
And if we go to, because I think there is so much, you know, and particularly the new guidelines during 2022 to 2024 under Sunat that have sort of come out, as I said, saying the sort of like stay off if you've had a concussion. If you are at 4 weeks post-concussion and you still have symptoms, then that's when you really need to seek medical advice as opposed to just sort of like resting.
I think looking at it, and looking at players of my era and my age, that if they, some of them are in denial, I can understand that.
Yeah.
But I think they need to be made aware that there are things out there to help you. Don't be afraid of it.
Yeah.
All it can do is good. It can't do anything bad.
Yeah. And I think the thing, Ray, which, thank goodness, as we said, your wife intervened here, But I think the part that so many people are less aware of, and particularly, let's say for football players, it tends to be in sort of like 60s and 70s. American football players, it's sort of like 50s, 60s. Rugby players, it's in sort of like 20s, 30s, 40s, is the beginning of these progressive neurodegenerative diseases, which, as we said earlier, are actually more closely correlated with subconcussions. And in fact, the average player, and this is from school all the way through, will suffer from about 500 subconcussions for every single big concussion. And about 3,500 subconcussions is when you start being at risk of developing this neuroinflammation that can lead to these neurodegenerative diseases. Do you think that's something that, you know, your colleagues are aware of and that the players today are aware of?
No, some may be players, but I can go back to a particular player who recently, when there was an England international, he was invited to Wembley, and a guy called Dave Watson.
Yeah.
And it was unbelievable. You could tell that he was affected by Alzheimer's.
Yes.
And I think the earlier they can get this thing out to players and make them feel that they need to do it, get out there, get it sorted, get it done, and that will help them through. And I think I don't know how you do it, but I think it needs to be done. Cognition Health, here we go.
Yeah. Well, that's so incredibly encouraging to have someone like you advocating this, because this is so important. And I think the big thing, you know, particularly with these subconcussions, is you have no symptoms with subconcussions. You just collect these during the time that you're playing. So it's a disturbance, it's a knock to the head, it could be heading the ball, it could be your head hitting the ground, your head hitting someone's shoulder or knee or waist or whatever. But there's a disturbance to the nerves and a disturbance in the brain, but there's no symptoms related to it. And that's why people are accumulating thousands of these subconcussions. And those subconcussions break down the blood-brain barrier, which is a very sort of precious protective layer around the brain. And that causes inflammation. And that's what then results in the development of these abnormal proteins. And if it's an amyloid protein that is predominantly performed, that goes down the path of Alzheimer's disease. If it's a tau protein, that could go towards chronic traumatic encephalopathy. But they're all sort of like started by this neuroinflammation, which is due to all these multiple subconcussions. And I think that's something that it's so important that people are aware of.
Yeah.
Do you think you would would you do things differently if you had your time over again, or how do you think?
Football wise?
Yeah.
No.
Yeah. No. I think that's what everyone says. So really, I think what is most important is having the knowledge and being aware, so that you can make informed decisions, and then you can respond quickly.
Yeah, I think you're right. I think that's it. And I think people need help. Whoever sees this podcast, I don't know, but they want to say to themselves, I'm going to get tested.
Yeah.
I'm going to get to see where I am in the development of Alzheimer's and do something about it.
And I think, Ray, when we say get tested, I think, again, for everybody that's saying, well, what do I get tested? Yeah. What do I test? And the answer is that you can't tell by talking to somebody whether they've got amyloid protein or tau protein in their brain. The way these proteins are identified are either there's various scans that can be done, or there's testing of the spinal fluid, as you had by doing a lumbar puncture. And actually there's new blood tests that are sort of like evolving and coming onto the market now, which I think will be fantastic for being able to screen people and find out, do they have the underlying pathology? And then the big thing, obviously, you have to have two things to make a difference in any disease or any condition, and that is the biomarkers to detect the presence of the disease really early, as in your case, and then the other one is treatments which, when given really early, will slow down further progression of disease and symptoms. by treating the thing that's causing the problem, and in your case, the amyloid protein.
Yeah.
And you know, what I think is really great is you're now over halfway through the first part of the clinical trial, which is when you could be on active medication, you could be on placebo.
Placebo, yeah.
And then at the end of that 18 months, everybody will receive the active medication. So you will definitely be receiving the active medication. If you're not on it already, you will definitely be receiving it.
That's a question mark, isn't it?
Yeah. And how do you feel?
What
do your friends say?
Well, yeah. Yeah, when I meat up with them, they say, you look great. You're right. You know, when we're talking, and I'm talking now, etc. But, you know, going back in time, I look back and I think, crikey, you were showing signs. Like in a conversation, I would forget where I was in that conversation and couldn't carry it on.
Yeah.
And then when that happened to me, I started to back away from that.
Yeah.
If we were in a sort of, a crowd, well, not a crowd of people, but people, and then I would sort of pull back, say nothing.
Yeah.
And it became, I felt quite embarrassed about it because I was talking and then all of a sudden I'd lose it. I just couldn't remember what I said.
Yeah. So you experience it, I mean, you don't appear to me to be experiencing that right now.
Oh, the drug must be working then, mustn't it?
Well, we don't know.
And Emer, I just want to add, because I'm so grateful, Ray, for you sitting here and answering these questions. But what does impress me, and I think it's a great example, is how you sought help very early, which is so important.
Yeah.
Because in my interactions with you, I would have no thought at all that you had any kind of memory challenges. And so you represent an example of you can't hide from it and run from it, which you didn't, and you sought help. So early detection is just so very important.
Yeah.
You're a great example of that.
Yeah, hopefully it will get out there to other players, you know, because I think you know what it's like, whether you're rugby players, NFL players or soccer players, as you call it in the States, that you're sort of a group of, you know, you can meet up with players that you talk on the same page. If you don't, you know, you're talking and you talk about this, you talk about that, and you're all in the same group. You know, you're a sort of big extended family. You know, so that I just think it's important, and I don't know how, but to get it out there to them, because and also there's this denial bit. I don't know how. Me personally, I don't know how they would deal with that.
Do you think that usually people are in denial for all sorts of reasons, but more often than not because they feel there's nothing that can be done? And that is obviously a very frightening situation.
No, it's not. And I think it needs to get out there. How, you know, I'm more than happy to, you know, the certain clubs are setting brain clinics or clubs up in there where ex-players maybe from the 70s and 80s meet up for 2 or 3 hours and you talk one about when you were players and everything else, and the benefit from that is they can remember and they talk and everything else, and we all become better players by talking that way.
Yeah.
But I think it needs more things like that, but dealing with the medical side as well.
Yeah.
Yes.
And I think it's not just the individual players exercising a certain amount of denial. I think it's their friends also indicating a degree of denial towards them. Mm-hmm. So I think if everyone is sort of like saying, look, actually, as your wife did for you, look, you know, I think there's something wrong, then more people, you know, will recognise and, if you like, admit and acknowledge that there is a problem. And certainly, you know, we are, you know, ready to test people, and actually, it's not just doing, you know, like asking people questions. It's actually doing these biomarker tests.
Yeah.
Because, as you know, we couldn't tell what was going on in your brain without doing all these tests. I mean, well, that sounds a bit scary, but yeah.
So, Amber, just as we begin to wrap up, because you represent this subject so very well. We could sit here for another 30 minutes or longer. But is there any last question or comment you want to make as we bring this podcast to a close?
From my point of view, I would say all you guys out there who played in the 60s, 70s and 80s, get in touch with Cognition Health, wherever you are in the country, because there are, I think, from memory, there's 7 or 8 clinics around the UK. Get in touch to see if you qualify for a trial and get on that trial ASAP.
That's great. And thank you, Ray. And I would say that there is so much research and development going on today in, I'm just going to call it the whole brain and mind space, but particularly for Alzheimer's disease. And there is a lot of work going on for CT, but at the minute, particularly as we all grow older, the risk of developing Alzheimer's disease is high. It is a pandemic, and it's even higher if you have been playing contact sport. So don't wait.
No, exactly. Yeah, that's the point. Don't wait.
Yeah.
Do it as soon as possible.
Yeah.
If not for yourself, for your family.
Yes. Yeah.
Ray, thank you so very much. You've been really, really open and helpful, and we
Well, thank you very much for making me do this.
Well, this subject is so of interest. There's a lot to be said. Emer and I will be talking more and more about CT and Alzheimer's in the podcast to come, but you've set this up very, very well. Thank you so much.
Thank you. Thank you for having me.
Thank you so much. Thank you.
That was Ray Clark, a celebrated English footballer, or as we say in the U.S., soccer, whose career spanned some of Europe's most competitive leagues during the 70s and the early 80s. He was known for his sharp instincts in front of the goal and brilliant finishings. He made a name for himself both in his native England and also with standout performances in the Netherlands and Belgium.